Good day, I am Luis Gabriel Bersuela. Today I'm going to demonstrate the incorporation of medication into a volumetric chamber. So the first thing that I'm going to do is to verify the physician's order, the medication card, and also to check and make sure to apply the principles of safe medication administration. So let's check the doctor's order. So the doctor have ordered ceftriaxone 1G IV infusion, dilute in 50 ml of 0.9% sodium chloride or NSS, and administer over 30 minutes. So the infusion rate is 100 ml per hour. Since the volumetric chamber is a microdrip. Then after verifying the physician's order is we're going to proceed in verifying also the patient's allergies, conduct skin tests if ordered by the doctor, check for the medication compatibility, and also check for the prescribed IV fluid solution. So after confirming the allergies and other things, is I'm going to proceed in preparing the materials that we will be needing, such as the prescribed medication, the volumetric chamber, the medication tray, the alcohol, the cotton balls, clean gloves, and other things that we will be needing. Then after that is I'm going to proceed in introducing myself to the patient and correctly identify them using the two identifiers, explain to them the procedure that we are going to do, and then obtain their cooperation. Okay? So now I will start. Good day, ma'am. I am Laris Gabriel Berzuala, student nurse po ako from Pamantasan ng Lungsod ng Pasig. May I know your name, ma'am?
Andresi Adra.
How about your age and birthday po?
I'm 51 years old. June 6, 1972.
Okay, let me check your ID band, ma'am, just to confirm. Okay? Okay po, ma'am. So, Miss Ada, right? So, what we're going to do po, ma'am, is nag-order po si doctor na mag-a-administer po kami ng ceftriaxone po. So, via Soluset po or volumetric chamber. So, yung ceftriaxone po is antibiotic po siya para po ma-prevent or treat po yung bacterial infection. So, yung procedure na po ito is maglalast for siguro 10 to 15 minutes lang, ma'am. And if meron po kayong concerns or tanong, huwag po kayo mahihiya magtanong sa akin. Okay po, ma'am? May mga question po kayo bago tayo mag-proceed?
Wala naman.
Okay, so after that, ma'am, can I ask for your full cooperation po? Okay po, ma'am. Thank you. Then, after that is we're going to position the patient comfortably and make sure to address any of their concerns. Okay? Ma'am, comfortable naman po kayo sa pwesto niyo po? Then, after that is we will now proceed in performing hand hygiene, and then make sure to use aseptic technique while putting on your clean gloves or any PPE that is required. Okay, so after that is we're going to proceed in assessing the IV patency for any signs of hematoma, bleeding, or any infiltration, leakage, and infection-related IV complications. Okay, so ma'am, check ko lang po yung swero nyo po. Okay, so wala naman pong redness, wala naman pong swelling. May nararamdaman po ba kayong masakit? Wala naman po. Okay po, ma'am. So, magsa-start na po tayo. Ready ko lang po yung gagamitin. So, after that, upon checking the IV patency and also the insertion site is I'm going to prepare the volumetric chamber. So, okay. So, this is the volumetric chamber. So, I'm going to clamp the roller clamps. So make sure to close it before proceeding. Okay, so after closing is I'm going to insert the insertion spike into the prescribed IV fluid, which is 0.9% sodium chloride. Okay, so make sure to maintain sterility while performing this. So I'm going to now insert the insertion spike, so make sure to do not handle this part. Okay, so after that is we're going to hang this. Okay, so after hanging is we're going to fill the volumetric chamber with the prescribed diluent. So since we're going to prime this first, we're going to put at least 35 cc, or you can do more. So make sure to unclamp this first. Okay. Okay, so okay. So after that, we're going to close this again. And then after that, we're going to prime the tubing to remove any air bubbles. So make sure to maintain the sterility of the distal end. Let's remove the syringe first and then prime this. Okay, so after priming is we're going to close it first, and then we're going to fill again the volumetric chamber with the prescribed diluent. So the doctor ordered 50 ml diluent for the antibiotic. So let's fill this volumetric chamber. Okay, so assuming that we have already filled this up to 50 ml, then we're going to proceed in incorporating our medication. So make sure that we're going to hang this. Okay, and after that is we will now incorporate our medication. So first is to disinfect the medication port with alcohol. Okay, then dispose. Okay, then after that, make sure that the air vents are open. So here, the air vents are open, as well as the floating valves are floating, to ensure that there's a smooth flow of the IV fluid. Then after that, we're going to administer our medication, which is ceftriaxone. Okay, so we're going to incorporate this here. Okay, after incorporating the drug, make sure to set this aside and then make sure to properly dispose it afterward. Okay, so after that is we will now proceed in disinfecting the main IV line or the Y port of the patient. Minsan ko lang po. Okay, dispose. Then after that is we're going to now connect the Solicet tubing into the HEP lock or Y port. So since this is needed a needle, so we will put a needle and then we will put this into the HEP lock. Okay, then after that is we will secure this with micropore tape. Make sure that it is secured so that it will not be pulled out easily. Okay, so now the it is secured. We will now proceed in regulating the infusion rate according to the prescribed infusion duration and the rate. So now let's regulate this. So we will regulate this 100 ml per hour. Okay, so after regulating the infusion rate or the flow rate is we will now proceed in putting on the IV label or the medication label on the volumetric chamber. So, the details that is included here is the patient's name, the age, sex, the room number, the medication that we have administered, which is ceftriaxone, the dose, the total volume, the rate, which is over 30 minutes, and then also the date and time that started, and who prepared the medication. So after that is I'm going to proceed in checking and monitoring the patient for any drug adverse reactions, compatibility issues, and then changes in the vital signs. And then also make sure to provide reassurance to the patient and evaluate their response and make sure to promptly report any abnormal findings and complications. Okay, ma'am. So, na-administer ko na po yung gamot nyo. So, after po niya, ma'am, meron po ba kayo nararamdamang masakit po?
Wala naman.
Wala po. How about, ano po, nahirapan po ba kayo huminga? Hindi naman po. Wala pong masakit? Okay. So, kapag may nararamdaman po kayo masakit or kakaiba, i-report nyo po agad sa nurses po, ma'am. Okay po? Okay. So, thank you po, ma'am, for your cooperation. So, if meron pa kayong concerns, wag po kayo mahiya magtanong. Okay po, ma'am? Thank you. So, after that is we're going to dispose all the materials that we have used into a proper waste receptacle according to the healthcare waste management and the infection prevention and control policies. So, we're going to put this into the sharps. And then make sure to dispose the materials that we have used into a proper waste receptacle. Then after cleaning our area is we're going to remove our gloves and then perform hand hygiene after the procedure. Okay, so after that is the last thing that we're going to do is to document the procedure that we have done and make sure to include the medication that we have administered, the time and date that we started it, the infusion rate, the duration, and also the patient's assessment and response, and other important nursing interventions. Then after that is to make sure to communicate effectively with the patient and the other healthcare team member, and make sure to demonstrate being present to your patient and use therapeutic communication. Then, for the professionalism and the patient safety, make sure to complete or perform the procedure confidently and systematically. Demonstrate strict adherence to infection prevention and surgical asepsis principles. Then, make sure to complete the procedure efficiently while maintaining safety all throughout the procedure. Also, demonstrate showing the uh, safe medication practice and show your professional behavior throughout the procedure. So that's it for the incorporation of drug into a volumetric chamber.